Welcome to ACA's 2023 Virtual Hill Day. I'm Sean Boyne, CEO of the American Counseling Association. Thank you for making time to invest in advocating for your profession. Today, our goal is to create counselor advocates. We also want to empower our members by equipping them with the tools needed to successfully advocate on the federal, state, and local levels. Also, encouraging counselors to recruit and engage other counselors that will in turn increase our presence on Capitol Hill. One of my priorities is to elevate the voice of counselors and the impact you all have on mental health in society. Advocating on behalf of yourself in this profession is one of the best ways to do so. As a professional mental health counselor, it is important to meet with lawmakers. They look to you as experts. The knowledge and experience you have can help shape policy. We are nearly 60,000 members strong, and collectively we have a loud voice, so let's please use it. Legislators pay attention when they hear from their constituents, and if they don't hear from you, they make uninformed decisions that impact you with long-lasting consequences. In the current challenging political climate, the role of professional counselors has never been more important. Whether it's helping to overturn anti-LGBTQIA bills in your state, pushing for Medicare inclusion, or running for political office, your role in the political process is critical. You have an obligation to uplift and empower not only your clients, but others in the profession and in your community. I know it can be intimidating to meet with lawmakers, but know that you're not alone. The Government Affairs and Public Policy team here at ACA are here to provide you with guidance on legislative priorities and provide necessary resources to help you feel more confident advocating for your profession. We know that mental health matters, so let's use our voices to let legislators know. We appreciate your participation in today's event. It is now my honor and privilege to pass it over to ACA's president, Dr. Kimberly Frazier.
Greetings and welcome to the 2023 American Counseling Association Virtual Hill Day. I'm Dr. Kimberly Frazier, the American Counseling Association's 71st president. Today, I have the honor of welcoming you all to the third annual ACA Virtual Hill Day. During today's event, you will hear from top congressional staffers, public policy experts, and our own ACA Government Affairs and Public Policy team on advocacy tips and legislation directly impacting the counseling profession. The role of counselors in guiding legislation is crucial in getting our bills to the finish line. It is up to us as professional counselors to advocate on behalf of the counseling profession, not only for ourselves, but for our clients. Although our Government Affairs and Public Policy team here at ACA has been working tirelessly each day to advocate on behalf of the profession, they cannot do it alone. As licensed professional counselors, we have years of experience and stories from working directly with our clients that Congress needs to hear. Counselors are a resource that our leaders rely on to make informed decisions. You may be asking, how do we do this? How can I let my voice be heard and tell my story to Congress? During today's event, you will learn tips on how to schedule meetings with your senator and or representatives and be provided with the necessary resources that will allow you to feel confident going into these meetings. You will also hear about several of our legislative priorities on which to help advocate. Please use the resources and important information that you will gain today to help you move the profession forward. Our goal for Hill Day is to have each and every one of you schedule a meeting with your legislators between now and July 29th. There's strength in numbers and there's power in our voices. So let your voice be heard. Welcome everyone to the 2023 ACA Virtual Hill Day.
Hi everybody, I'm Guy Letard, the Government Affairs and Public Policy Manager for ACA. Welcome to today's Virtual Hill Day for ACA. Today I'm going to go through the agenda for the event. And today we'll discuss a lot about some of our legislative priorities, as well as you will hear from congressional staffers and the ACA Public Policy and Government Affairs team. And some of the topics will include maternal mental health, active duty and veteran mental health policy, increased federal funding for school counseling programs, career counseling legislation, and preparing for congressional meetings. I'm going to kick it over to Christine Blackwood, who will go through our legislative, our legislative advocacy tools. Christine Blackwood has been a counsel for unreported legislative and public policy practice since 2015, bringing over 21 years of public service in senior positions in both chambers of Congress and 2 cabinet departments, where she focused on federal healthcare program oversight, healthcare policy. Christine provides strategic counseling, coalition and advocacy campaign support, and direct lobbying services to help clients achieve their legislative and regulatory goals. She served in the office of the Secretary of Health and Human Services under the Obama administration, where she was responsible for leading the department's strategic response to congressional oversight, audits, and investigations, including the Affordable Care Act, Medicare and Medicaid reforms, the Indian Health Service, mental health reform, emergency preparedness, scientific research funding, the FDA drug and the medical device approval process, and a host of other programs. So with that, I will kick it over to you, Christine.
Thanks so much, Gila. I really appreciate it. And thank you, everybody, for participating in this webinar. I'm going to talk briefly about the American Counseling Association's top federal legislative priorities. And we also have, as you know, we have some representatives from the state legislatures to talk about what's going on at the state level. So first of all, let me think, Gila, if we could go to the next slide. First of all, what I would like to say on behalf of the American Counseling Association, which we are proud to represent and work with closely on Capitol Hill, is a big thank you with respect to the Medicare bill that passed in Congress last year. Achieving Medicare provider status for counselors has been a longtime goal of the American Counseling Association. And thanks to the hard work, activism, and persistence of many of you participating in this webinar, we achieved that goal in December of last year. And we continue to engage in this with the Centers for Medicare and Medicaid Services, which is in the process of implementing the new law, so that we have a smooth transition, hopefully, for all of the counselors and for the millions of older Americans who will now be able to access the mental health and substance use disorder services that they need from licensed professionals like you. But people on Medicare are not the only people who need and are not able to receive the amount, volume, and quality of professional mental health services that you can provide. So as we are recovering from the pandemic and trying to build more resilience in in individuals and in communities, we need to ensure that these other populations, veterans, school-age children, teachers, new mothers, job seekers, people living in underserved communities whose overall health and well-being is impacted, including their mental health, who suffer due to less access to nutritious food, safe housing, educational and job opportunities, economic instability, and language barriers. In other words, the social determinants of health. And the American Counseling Association is deeply committed to advancing the professional development of counselors, advocating for the profession, and moving federal policies in a direction that enable all of us to improve our daily functioning and quality of life thanks to the professional services that you provide. So starting with veterans, if we can go to the next slide, that would be great. Thank you. There are seven pieces of legislation in Congress that are now pending. that we would like to talk to you about. We're going to start first with veterans health and then go to students' mental health, school-age children's mental health specifically, and teacher and educational staff professionals' mental health issues, and maternal mental health, career counseling, student loan assistance, which we know is a really important aspect of building the pipeline of mental health professionals. And then last, but certainly not least, a bill to ensure that equal healthcare access for all people. So if we could go to the next slide. With respect to veterans, the Veterans Administration, as some of you may actually know because you serve these communities of veterans and you work with them, the Veterans Administration provides community-based counseling centers called VETS centers that provide a wide range of social and psychological services. And the notion behind these VETS centers is that we want to have a place that is located near to the veteran's home, as near as possible, so that veterans don't have to travel long distances, which would be a deterrent to seeking mental health that they need. The vet centers, their role has been expanded by Congress over the last several years, and although there are currently 300 vet centers in the country, and there are also something like 83 mobile vet centers, which are large vans that move around, for instance, rural areas, so that they can provide confidential counseling to various communities. And there are other things such as vet center outstations in rural areas of the country. The need far exceeds the ability of the Veterans Administration to serve the veterans that do need help. And so this bill is very important. It was introduced on a bipartisan basis in the House by Representatives Mikey Sherrill, who represents a district in New Jersey, Brian Fitzpatrick, who represents a district in Pennsylvania, and Tom Keene, who represents a district in New Jersey. And each of their communities lacks vet centers in their areas, but the bill has picked up some steam. It's got 18 co-sponsors, and we're hopeful that the Veterans Affairs Committee will take up this bill this year. Next slide, please. So as we all know, the pandemic really put a spotlight on how many students are struggling with isolation, depression, and mental health challenges. And the challenge of the youth mental health crisis is truly severe. Congress has turned a lot of attention to it this year. What the pandemic also highlighted was the shortage of mental health professionals in schools who are equipped to counsel students and help them heal and have the resources they need and that we all need them to have to succeed in and out of the classroom. So in order to build the pipeline of school-based mental health professionals, this is legislation that would enable more students to afford the graduate programs that center on school-based mental health, and would enable us to attract more professionals to this very critical field. It would allow the Department of Education to provide matching funds to various graduate programs that specialize in school-based mental health counseling. ACA has endorsed this bill, and it is something that we hope is going to pick up more traction in this Congress. Next slide, please. So the teachers have also felt the mental health crisis in the country, and teachers, according to a 2021 RAND analysis, teachers are almost 3 times more likely than other adults to report symptoms of depression. We know there's a crisis in our schools, both with the students and teachers and professional educational staff. So this bill is designed to improve coordination among the federal agencies that have a stake in how our educational system functions, and to ask that the Department of Health and Human Services and the Department of Education work together to develop best practices for preventing suicide and improving the mental health and resiliency of education professionals. It would also ask that these federal agencies, these cabinet agencies, work to train education professionals in strategies to promote their mental health. And it would do so by providing 3-year grants to state and local educational agencies and institutions of higher education to encourage them to establish programs to build mental health resources among the educational professional workforce. So it's really kind of a bill that provides structural supports in which counselors would play an important role in terms of advisory roles and providing technical assistance, and another way to ensure that we have healthy schools for children. Next slide, please. So I think a lot of people know how the United States is singularly having a lot of difficulty in meeting the challenge of maternal mortality. We have the highest rate of pregnancy-related deaths in the developed world, and Black women are 3 to 4 times more likely than white women to die from pregnancy complications. And these kinds of really shocking and unacceptable rates of maternal mortality are accompanied, of course, by long-lasting and even generational cost at the emotional, physical, and economic level. And this bill would establish a grant program at the Substance Abuse and Mental Health Services Administration within HHS that would allow entities to partner with the federal government that would be community-based organizations that prioritize the demographic groups that are experiencing elevated rates of maternal mortality, morbidity, mental health disparities, and adverse perinatal or childbirth outcomes. It would also, of course, important to counselors, expand the available funding for the mental and behavioral workforce that is serving this population, and diversify the workforce that is serving the population, which are 2 important principles to the American Counseling Association. Next slide. So there are 7 pieces of legislation, and we're a little bit more than halfway through covering them. This legislation, the Navigating to Success Act, is a bill that was introduced by Joaquin Castro, Congressman from Texas, and it's modeled on a successful program in San Antonio called Project Quest, which is a program that provides skills training to individuals on a personalized basis to better prepare them for high-paying jobs. The program has demonstrated a lot of success in providing wraparound services that people need as they're going into the workforce and as they try to achieve more success in the workforce, such as tuition assistance, rent assistance, utilities assistance, childcare assistance, and specific personalized help dealing with coursework and college classes and continuing education. So the American Counseling Association is supporting this bill, and we think this is an important facet of counseling, and hope that this bill will see some success in this Congress with your help. Next bill, the next legislation. This is, we have two left to go over, and this bill, which was introduced by a bipartisan group of senators, is the Mental Health Professionals Workforce Shortage Loan Repayment Act. And the motivation behind this legislation would seem fairly obvious. We need to help people get through the student loan process. We know the student loans are really provide a huge debt and a deterrence to people pursuing higher education degrees, as most of you have done. And this is designed to address specifically the many areas of the country that have a shortage of mental health professionals. There are about 160 million Americans live in areas with a mental health professional shortage. The Department of Health and Human Services actually estimates that there will be a shortage of over 250,000 mental health professionals by 2025, which is only 2 years away. This bill would repay up to $250,000 in eligible student loans for mental health professionals who agree to work in these mental health professional shortage areas. So for a period of 6 years, 1/6 of the loan would be forgiven for each year of service. We think this is a really important measure that recognizes that we need to help people, and we need to living in these tragically underserved areas, and also encourage counselors and facilitate their ability to work in these areas of the country. Then the next slide, please. So last but certainly not least is a very important bill which has been introduced by both in the House and the Senate. In the House, it was introduced by a lot of members of the Congressional Black Caucus. The bill was introduced by Adam Schiff of California. And it would basically establish the principle that hospitals must provide the same high quality health care services to all patients, regardless of race, national origin, sexual orientation, gender identity, disability, age, or religion. Would create a federal health equity commission to oversee the progress in efforts towards health equity, and specifically create a formal office within the Department of Health and Human Services that would enforce consideration of healthcare as a human right, a protected civil right, and it would improve our ability to collect data to inform the providing of more equitable healthcare practices, and to provide grants to encourage providers to practice equitable healthcare. This too is something that is very important and is really at the core of the ACA's principles and mission, and we are going to be advocating for this bill as well. So with that, I thank you for paying attention as we went through the 7 major pieces of legislation that are priorities for the association. And if you have any questions, we're at the end, I think if we have a few minutes, happy to respond to them. And with that, I'm going to turn this back over to Dominique.
Hi, folks. I'm Dominique Marsleck. Apologies. I'm Dominique Marslick. I lead the state portfolio for the American Counseling Association, and I'm excited that you are attending our Hill Day this year. This year, we have a unique setup. We are including state representatives and state legislation, as we have seen so much activity in state legislatures this past year or two with increasing complicated policy issues, in addition to a large success when it comes to our counseling compact. We are currently at 28 states with 30 enacted states expected by the end of the calendar year. Our speakers today include Senator Cleary. Senator Cleary was elected to the North Dakota State Senate in November of 2022, where he serves as the Vice Chair of the Senate Committee on Human Services and the Senate Portfolio Leader for the Theodore Roosevelt Presidential Library. He represents District 35 in the center of Bismarck, where he was born and raised, and now lives with his wife and their daughter. When the legislature is not in session, Senator Cleary works for the Theodore Roosevelt Madura Foundation, an organization dedicated to sharing the beauty of Western North Dakota with visitors from throughout the country. He previously served on the staff of North Dakota Senator John Hoeven and Governor Doug Burgum. We also have in attendance, I am not sure if she has logged in today, so hopefully we have in attendance Representative Mari Levitt. Representative Levitt is a small business owner, former PTSA leader, and strong supporter of Washington military families. Representative Levitt joined the Washington State Legislature in January of 2019, where she serves as co-chair of the Joint Committee on Military and Veterans Affairs, and as a member of the National Committee for the State Legislature's National Task Force for Military and Veterans Affairs. She also served as vice chair of the Post-Secondary Education and Workforce Committee, the vice chair of the Housing Committee on the Capital Budget Committee and Rules Committee, the NCSL Education Committee, and the Council of State Governments Education Committee, as well as a member of the Washington Task Force Against Trafficking of Persons. And in 2022, she was elected by her colleagues to the leadership role of Deputy Majority Whip. At that, I welcome our speakers today. We are so thankful that you have chosen to spend this time with us to talk about your legislative accomplishments in the last session. Both elected officials championed the counseling compact in the last legislative cycle. And I will go straight to the Q&A. So our first question is, what were your major legislative goals and accomplishments in this past year?
Thanks for the question, Dominique, and it's great to be with you and your members today. And just wanted to start with a thank you for all they do to serve people throughout our country. But it was my first legislative session here in Bismarck, North Dakota, and it was a busy one. You know, I enjoyed working on the counseling compact, and a lot of my other priorities focused around the human services, health and human services space. My colleagues sort of teased me when I was coming in that I was the first person to request being on the Human Services Committee in a while as their first choice, but it was really a rewarding opportunity to work on a lot of important issues that impacted a lot of people. So the counseling compact, obviously what we're here to talk about today, but also issues related to family caregivers for folks who are aging and disabled, and prevention programs for domestic violence, and helping people afford the cost of insulin were a lot of the big priorities in the human services space for me this session. So thanks again for having me today. Looking forward to the conversation. And Dominique, you're muted.
Thank you so much for your answer. That was excellent. It looks like the representative has not been able to log in yet. She's in a different time zone, so we'll give her a minute. If for some reason she's not able to join us today, I will make sure that we get written responses to the questions and send them out to those who attended today, in addition to our other materials. So moving to our second question, Senator, you sponsored and led on the landmark counseling compact in your state, allowing for practice across state lines. Our members are so thankful and so excited for practice privileges to begin in 2024. What were some of the obstacles, lessons learned, or highlights of working on this bill in your state?
Well, each state legislature is different. In North Dakota, we meet only every other year for 80 days. And so things can move pretty quickly, and it provides a good opportunity for, getting important things done in a quick amount of time sometimes, like this counseling compact. But there are also a lot of moving pieces. And so a constituent of mine had called about the compact. I think it was the first day of the legislative session, and, was great to get right to work, but it really was a flurry to get it all done. And something I think a takeaway for your members, throughout this panel might be the importance of building coalitions with folks who have shared goals with you. And in this case, it can be from a variety of different perspectives. I, received support from the military community, obviously from counselors and providers, but even folks in private industry. I had someone from a oil company come up to me and thank me about this piece of legislation, and I found out that they'd had a death on their work site a few weeks previously, and they just couldn't find access to counselors in person or via telehealth was a challenge. And so that really was a highlight for me working on this, was just knowing that it'll impact people in a positive way.
That's wonderful. Thank you so much. And I love that you highlighted coalitions. That has become increasingly important in state legislatures. What we are seeing is a lot of, unfortunately, a rise of partisan politics in state legislatures. Whereas in the past, state legislatures were often exempt from that kind of DC partisanship. We are seeing a little bit more in states than ever before. And as this happens, it's really important for folks to consider outside the box. What can you do to advocate in your community for the things that are important to you, or for what is important to the counseling profession? So definitely coalitions are a big part of our message this year. So thank you for highlighting that. It looks like we are joined by Representative Levitt's staffer, Kat. I am not sure, Kat, did you want to speak on behalf of the representative, or do you want us to reach out after the presentation for written responses?
I'm here. Hi, this is Rep. Levitt.
Oh, wonderful. Thank you so much. We did an introduction for you earlier, a very phenomenal and exciting resume. And of course, the passage of the Counseling Compact was such a remarkable accomplishment this past year on the West Coast. You are our only West Coast state, our first West Coast state at this time. We currently have the compact enacted in 28 states. We're hoping to have enactment reach 30 states by the end of the calendar year, and we expect to meet that goal. So Senator Cleary from North Dakota quickly went over his legislative goals, his accomplishments, as well as his leadership on the Counseling Compact. So I'll kick it back to you as to what you feel your major legislative goals and accomplishments were this past session, as well as lessons learned on the Counseling Compact.
Sure, and thank you all for having me. It's a delight to be with you, and apologize for being a little tardy. I'm at a different meeting in Vermont, so had to step out of that meeting, get back to my hotel room, and quickly log on and get internet access to join you. And then I'm going to go back to the meeting. So here I am. But yes, my name is Dr. Mari Levitt, and I represent the beautiful 28th Legislative District in Washington State. For those of you who aren't familiar with Washington State, you all know Seattle, so I'm about 45 minutes south of Seattle, if it's the best way to describe it for those of you who aren't familiar with Washington. I also represent Joint Base Lewis McChord, which is the largest military installation on the West. And we have a lot of military spouses, so it was great to hear the tail end of the senator's comments on military members and veterans and military families. And so, the goals of our session this in 2024 really centered around workforce, housing, and public safety, were our top three priorities for a lot of different reasons that I'm sure Washington is not unique. And I will jump in and just say real quick before I launch into the Mental Health Counseling Compact, that Washington State is still a pretty strong bipartisan working state. 94%, 95% of the bills that we passed were bipartisan, strong bipartisan support. 70 or above. And so we really continue to work very well together and very closely together on a lot of these issues. And there's no more perfect issue to work on collaboratively and in a bipartisan spirit than behavioral health. And so behavioral health and housing, we in Washington State, we call it the year of housing, but we also, sleepily call it the year of behavioral health, because we invested significantly in behavioral health, whether it's in the capital side of facilities and expanding out community sites and facilities. But in addition to substance use disorder treatment services and providers, we did a 15% increase in Medicaid rates, which is huge when you're trying to build a network adequacy, particularly for our low income folks across our communities and across our states. It's really important that we increase those Medicaid rates, which are woefully low, and negate opportunities and access across the board, whether you're in the K through 12 system and working on children's behavioral health, which we know is I've got 3 kids in public schools. And so I'm a 5th grader, 6th grader, and a senior soon to be as of this week. And so I know how important mental health is for our K through 12 system and post-secondary education. We expanded that as well. And then, of course, workforce, pick a topic or pick an industry, and they'll tell you that they have a workforce shortage, and no more so than our mental health counseling. I'm, very, very proud to get the mental health counseling compact introduced and passed in 1 year in the same session. In fact, in Washington, we had 4 workforce interstate compacts passed this year: the mental health counseling compact, the speech and audiology compact, the nursing compact, as well as the dental and dental hygienist compact. I think we were the first state. So, if North Dakota wants to join us, we need some more, although you're a little farther away, but we need some more folks to join that compact. And then I just finished up a meeting yesterday on the physician assistance compact that I'll be bringing forward this upcoming year. And so, mental health and counseling components are critically important, whether it's working with EMS folks or our law enforcement, and having a tag along person who is a counselor, because we want to divert whenever we can. We know that a touch in the justice system is not helpful when you're looking for housing and employment. So anything we can do for diversion, working with law enforcement, is a good thing. And so having and passing the mental health counseling compact with the great support, and I'll tell you how we did it in Washington, and you all were a big part of our success, but with the great support of the workers who are doing the work, which is you all. So, advocacy is critically important. And for our mental health counseling compact, if it weren't for the National Association coming in to testify in the House and in the Senate, it's not just one chamber. I happen to be in the House, but it's great if I can get it out of the House, but doesn't guarantee that I'm going to get it out of the Senate. And so working with partners in both chambers, you all doing that, advocating to your own state representatives in the districts that you live in, if you happen to live in the state of which you're advocating, which is really important, and galvanizing your peers who are also working on that particular issue to write emails to your particular and direct state representative or state senator is critically important. I have a folder. I'm pretty honest and open about it. If they're non-residents, they go into a non-resident folder, and I don't pay a whole lot of attention to it. The residents who are in my district, I look at the addresses, and I know that they're the ones that I need to pay attention to in terms of what's important to them. And so they get a higher profile, if you will, or more attention, as it should be. And I know that I am not unique in that endeavor across the state. And I'm sure the senator would agree with me on that. And so really, having you all advocate individually as members, certainly, and you're encouraging your peers to advocate to their direct representatives and senators. But I think in addition, those who are willing to testify, it's very helpful for you to testify on these bills. We had some great folks testify but you can have too many testifiers too and irritate the chairs. There's a delicate balance between, testimony and then overdoing and over making your points and irritating a chair to the point where they may not be as guided to or do an early movement out of committee than as it moves along. And so that's where each individual member can come in and sign in, at least in Washington State. You can do it virtually. You can log into your computer from the comfort of your home, and you can log in and support a bill or oppose a bill. And so we really encourage folks who are counselors or affiliated behavioral health folks to log in and support of the bill, both in the House and the Senate. So our numbers continue to grow. So we had strong support and testimony and very strategic and comparable testimony in the hearings, both in the House and the Senate and committee. And then and again, making sure that we had folks signing in support of the bill all the way through. We didn't have any opposition. There were some nuances to the mental health counseling compact that required a little bit of change. Our Department of Health likes to have their Washington flavor on all things health related bills, and state agencies can be a help or a hindrance, and they can candidly sometimes act in a passive aggressive way and say they're supportive, but put big fiscal notes on things that that indicate that they have a difference of opinion, but they're not willing to tell you that. And so we had to navigate a little bit in Washington, some changes that our post-secondary education institutions were going to have to do. And so we hit some road bumps. I'm very grateful that we were able to work through those. We didn't change the compact language, but we added a couple of things in there that allowed for those institutions who had students going through a particular pipeline to be able to continue that pipeline, and then also choose to participate in the compact if they complete all the requirements, or not to choose. To participate in a compact is a choice, and so we think most people will. The other thing that we really galvanized and supported, we have very close relationships with our Veterans Legislative Academy or Council and our military spouse liaisons across the state. So our spouses came in pretty strong as well, and advocated for the importance of their ability to get to work quickly. When 1 in 5 Washington military families have food security issues, it's really important that our military spouses get to work and partners in order to take care of their family. And so they were a good partner. I would encourage states to consider working with your military folks. In particular, military spouses are powerful voices. And they can advocate and be a good ally with you on some of these things. But if it weren't for your efforts, both in signing in and testimony, as well as other matters throughout both, and also patience, there were a couple of times in Washington where I said, do you want a compact or do you not? Because we're going to have to make a little bit of a tweak in some other way in order to make it happen. And the other thing that was really helpful is the association and our state council and others were very engaged from the beginning all the way through the end. They stayed wonderfully connected with me and with our staff who were drafting the bill, and we have nonpartisan research staff. And so they connected with them. They reviewed drafts quickly and got feedback quickly, I think is also very important. So staff weren't waiting around. And so I think all of those things helped us to be successful in getting the compact passed this year. It's a little rocky road, but and especially having chambers who do things a little bit differently. And I'm sure we're not unique in Washington State, where the Senate and the House have their own way of doing things, and sometimes their own way of crafting policy and drafting. And so we had to, work through those hiccups, but we started early and that helped, and then stayed fully engaged, myself, you all, individual members who live in our state, and our council. And then the Council of State Governments were also very helpful. They met several times with our OPR staff in order to make sure that the language as we crafted it would hold muster and would count if we were to pass it. Because the worst thing you can do is get a mental health counseling compact passed or any behavioral health work passed and find out that it can't be implemented, which is often the case in policies that we pass. So it was a good effort, but it was really a collaborative, intentional, very engaged effort that allowed us to get to the point where we were. And, it being a workforce bill, behavioral health is a top topic across our country, I think certainly helped, but the engagement and the can do, like, okay, we have a road bump, we'll figure it out, versus nope, we're not going to do that. Really helped save the bill and get it over the finish line and have the governor sign it.
That's such an awesome answer. Thank you so much. You touched on so much information, and we could talk about this forever because the counseling compact did require so much coalition and partnership in Washington State and in North Dakota. In Washington State in particular, we did have to update local code, which is what the representative was referring to in adjusting some language particular to Washington State. Some of the states do require us to go in and add a section that is only about, the local code to update it to reflect the standards of the compact. In Washington State, they did it in a way that works best for them, and that allowed us to pass the compact, which was a huge win for Washington counselors. So thank you so much for highlighting that work. And in talking about some of the points you had, the advice you gave to our counselors, I want to ask both Senator and the representative on behalf of our counselors. They are very interested in advocacy for themselves and the clients they serve. In addition to the advice you gave in reference to the compact, what advice would you give folks interested in advocacy in your particular state, in your region, and how would you advise them to expand beyond traditional advocacy methods to include relationship building with folks that you might not have thought of before, or you never knew you had to build partnerships with? This can include governors, agencies, as the representative talked about, professional boards, etc. So any advice would be welcome, and I'll turn it over to the senator and then go back to the representative. Thank you.
Well, Representative Leavitt gave a lot of great advice on advocacy and getting things through the legislative process. There's a lot of differences between states, but it sounds like there's a lot the same in the legislative process. And so, Representative Leavitt mentioned it, and Dominique, about the importance of coalitions and building a variety of perspectives as things move through the process. But I think sometimes what folks forget too in this legislative process is you do need people to be able to champion and push it through the process. It doesn't just happen on accident. So it's important to build that broad coalition, but then also making sure that, you have folks who can get it through both chambers. And it's can vary by state too. But another thing, just the importance of building relationships, it's fairly easy in North Dakota. I represent 17,000 people, which I think is the smallest per capita of any state in my hometown. So, legislators are really a phone call away, sometimes even shorter for me. I can see the state capitol from my window here. But the importance of building those relationships as you move through these processes. So maybe they're not hearing from you the first time when you're navigating these legislative processes. The importance of building those relationships and being able to use those when you're advocating, I think, is tremendously beneficial.
And I'll piggyback on the senator's great comments that looking at unusual allies, I think is an excellent point. For example, in Washington, you can look up who is signed in to testify on, or signed in support on a bill, or signed in to testify. You can look up both as the bill is moving through a hearing. And so I would advise at least associations and others to take a look at who are the groups that are signing in support of this bill. For the mental health counselors, we had the State Directors Association, which is school board members. We had the Principals Association signing in because they saw it as a benefit to them for K through 12 workforce shortages and challenges. I mentioned veterans and military spouse organizations signed in. The Department of Defense, they have liaisons, military related liaisons in each of the states, and they're assigned to states that they serve, 4, 5, 6, 7 states at a time. But often they will sign in support of counseling, the social workers organizations, which is, like your sisters, I think probably is a better way to describe it. They would sign in support. And so identifying, to the senator's point, who are those state associations, and really start to develop some collaborative conversations about, these are our priorities. Are any of these aligning with yours as you go into the session? And how can we work together to sign in support? When our leadership takes a look at, when we're in rules, I sit on our rules committee, we often look at what's the probability of it being a short floor debate, which is a sad thing to say, but that's the truth, because sometimes things take a lot of time and they suck up the air, and that means you can't get as many bills through. And so if there's a lot of support, we'll look at the range of folks who are in support that are important to our state, and take a calculated risk. Okay, everybody's in support of this, where we can move forward. And then we also look at what's the likelihood of it getting support in the other chamber. Our chambers are a little unique and different in the state and in the House in Washington. And so just because something gets through the House doesn't mean it's going to get through the Senate. Even though the parties are the same, there's differences of opinions and perspectives and experiences. And so and vice versa. And so trying to make sure that things have a path forward, and the more you can align with your allies to have you be in support of something, I think is really important. And including, I've mentioned law enforcement and the Prosecutors Association a couple different times. They're very supportive of behavioral health and mental health efforts. Because it helps them as well. It helps their work and lightens their load, if you will. And also the hospitals and healthcare workers. And so involving them in those organizations in the work that you're doing, I think is also really helpful. And then local teachers groups, et cetera, of course.
Yes, thank you so much, Representative and Senator Cleary. That's phenomenal advice. Some of those groups are definitely partners we've never considered before. So I think that was very on point and important advice for our members. So thank you. We are running out the clock. I feel like we could talk all day. But I do have one last question for Senator Cleary and Representative Levitt. Are there any behavioral health bills that you plan on introducing next session, or any further mental health projects you might want support on, or to include our counselors on in your region that we haven't talked about today?
Well, looking forward to the next session, building on the work we've done here, and Representative Levitt mentioned it, but it's a combination of things. It's things like these workforce issues, and we have different capital projects that we're looking at too, and making sure we're doing that in a way that's serving folks in the communities that they live in, that they don't have to travel a ridiculous distance to get here. In North Dakota, maybe the traffic isn't as bad, but still hard to get around. And so going to be looking at those. And then also this last session, we passed a commission to review suicide fatalities in a similar way that we do for maternal deaths. And we're hoping that recommendations out of that can be used to improve some of our behavioral health services in North Dakota. We struggle a lot with suicide. It's one of the highest increasing rates in the country, and other things like substance abuse. So hoping that we can build on the work we did this session to improve those services throughout the state, especially in a way that a rural state deals with some unique challenges compared to some other areas. So thanks again for having us today. It's been great talking with these issues with you.
And I'll jump in. We are working on similar kinds of things for 2024. Certainly adding on the capital side, adding facilities across the state in different jurisdictions to make sure that there's access and there aren't deserts. In our, the west side of Washington is more Seattle, Tacoma, more it has rural and urban, but on our east side, it's definitely more rural. And so making sure we have capacity and that we're incentivizing behavioral health workers and mental health counselors. We've done quite a bit of work over the last 3 or 4 years to make sure that we are providing loan forgiveness programs, conditional scholarships, and other kinds of things as incentives. And so we'll continue to do that. We'll continue to take a look at the Medicaid rates, which are really important to make sure we have providers who are willing to take on clients and increase our network adequacy, and would appreciate help on our workforce and workforce rate issues. And then again, just making sure that we're building capacity both in our school districts, K through 12 across, which we just are nowhere near where we need to be. And then in addition, implementing our 988 911 system. We have a robust couple bills the last few years on 988 programs, but implementing them and making sure we're investing in mobile crisis response teams that go out across the communities, and other matters associated with data that we're collecting to show the efficacy of a lot of those programs, so that we can continue to build on those in resources, both on the operating budget, but also in the capital side as well.
I love that.
Working closely with our first responders, our fire and EMS and others to do that work.
That's awesome. I think in mental health, we're definitely very interested in how to partner on crisis intervention. And so that sounds like really critical work that our counselors would be very interested in, as well as suicide prevention. So I am really thankful for your leadership on these issues. If any members are interested in participating in these advocacy efforts, you can reach out to us at advocacy@counseling.org, and we'll get you connected to the senator or the representative here today to support their work. Thank you again for your time today. It has been enlightening. Our members are so thankful. We'll be sending out this information to everyone who signed up for the event as well as sharing it on social media. So please feel free to share in your state as well. And thank you for joining us today. We'll be going on a break now for a few minutes for folks to run and get a coffee, and we'll be back soon. Thanks.
Thanks, Dominic.
Thank you so much. Have a good day.
Take care.
Good afternoon, everyone. Welcome back. My name is Sydney Sinclair, and I'm the Government Affairs Coordinator here at the American Counseling Association. Today, we are joined by three incredible panelists who have the years of experience on Capitol Hill and working in the federal government. Today, we are joined by Lisa Pino. Lisa is a Health Innovation Fellow at the Aspen Institute, where she is leading a venture related to health equity across underserved communities. A seasoned attorney with 15 years of public sector, government, and private practice experience, Lisa was also a former appointee of the Obama and Biden-Harris administrations. Her federal experience includes service as the Director of Civil Rights at HHS, Senior Counsel to the Secretary at DHS, Deputy Assistant Secretary for Civil Rights at USDA, and the USDA SNAP Deputy Administrator. Her state government experience includes acting as the Executive Deputy Commissioner at New York State's Department of Health under former Governor Cuomo's during the COVID-19 public health emergency. Lisa joins us today with both the state and federal perspective. Also joining us today, we have Mara Boggs. Mara has worked as a member of Senator Joe Manchin's staff since December 2011, where she has worked in Senator Manchin's Washington, D.C. office, serving as the Senator's Chief of Operations and Senior Advisor. She returned home to West Virginia to serve as Manchin's State Director in 2014, where she oversees the Senator's operations in the state, focusing on helping all West Virginians and developing opportunities. Because of her public service, Mara was named West Virginia's Wonder Woman by West Virginia Focus magazine in 2014. Mara has a master's degree in clinical mental health counseling from Wake Forest University and is an ACA member. She not only has the experience on Capitol Hill, but is a counseling professional as well. She serves on several boards, including the Yeager Airport Board, and affiliated with numerous veterans organizations. Also joining us today, we have Layla Brooks. Layla is the Senior Legislative Assistant for the U.S. Representative Troy Carter and a fifth-generation DC native. She graduated from Virginia State University and HBCU in Southern Virginia with a bachelor's degree in criminal justice and political science. Later, she graduated from George Washington University with a master's degree in public administration. For 3 years, Layla has worked in both the Senate and House side in various offices and committees, where she is currently working as a senior legislative assistant for Congressman Carter, handling his homeland security, education, financial services, housing, science, space, and technology portfolio. We have an incredible panel today, and we are excited to dive in. So thank you all for joining us. Let's begin today's conversation by providing any advice that you all would like to give our counselors on getting and staying involved in advocacy efforts with their elected officials in their districts.
Thank you, Sydney. This is Lisa Pino. Thrilled to be here. Did you just want to share a little bit on that question?
Yes.
Sure. So I'm happy to do that. So I'm Lisa Pino, and I have served in senior leadership roles in 3 executive departments. So one is USDA, DHS, and most recently HHS. So I'll give like some quick tips. When you are in an executive agency at a leadership level, as you can imagine, time is of the essence. Everyone's busy, you're spread thin, you're doing so many things. So I think it's so helpful when I've met with advocates across the years and I think Senator Leavitt hinted that earlier, is really be organized with your time. Time is precious. So just, at the onset of the meeting, after you say, hello, how are you? How are the kids doing? Being able to say, look, these are the 3 major policies or points that we wanted to present to you. And here's our rationale. But keeping it very clean and consistent, like the more that you can sort of organize your thoughts and policy perspectives, that really helps so that, the agency leadership person can more easily translate, understand, or be able to carry over to their respective leadership what you're trying to articulate. The more dense, the more clean and organized and consolidated your viewpoint is.
That's great. Does Mara or Layla want to provide any advice?
Sure, that's great advice, Lisa. And I'd like to thank Brian Banks for asking me to come back and speak with you again. Just kind of following what Lisa said, I'd like to congratulate you all for the Medicare reimbursement for counselors and MFTs. I know what I'd like to say is really just talking to the right person can make all the difference. Last year, I joined you all and you raised this as an issue, talked to the senator about it, and then he was supportive of it through many negotiations because of your advocacy and the professionals who contacted us after that. And that's why it's important to develop relationships with really anybody in government roles, whether it's an intern. I have interns sitting over my shoulder right now, listening in, is I'm talking to you all and hearing from you. You never know who they could talk to. They could take a walk with a senator, take a walk with the cabinet secretary, whomever it is, and tell them what's on their mind. That's one way that the 988 crisis line came about, and it was recently passed last year. And there's another bill out there that's kind of happening like that too. The COSA bill, the Kids Online Safety Act, that the ACA is supportive of. Senator Manchin just decided to co-sponsor that after a professional talked to him about the importance of that bill. So what I'm saying is your voice really, really matters. Your experience really, really matters. And if you use that voice and talking to those who are currently in a position to make change in government systems, you can make all the difference in the world.
And I'll jump in here. I want to say thank you to Brian as well for having me on this panel. I would definitely agree with my fellow panelists here that relationships do matter. Know who you all are talking to as well. I work in an office where we are the only Democrats, the only Democratic member inside of the state. So, sometimes you jump from office from office to office and, changing your tone, knowing your audience, know who you're talking to and things like that. And then also respect the staffers that work in the office, respect the person that, you are talking to within the office. So, the staffer is always in the ear of the member. So of course, we're not really supposed to make promises when you all haven't asked, but we are in the member's ear. So of course, we, brief our member afterwards with the ask that you all would like to see.
That's great. That's super helpful. As Christine had mentioned earlier at the beginning of this presentation, we have a long list of bills that many offices may or may not be aware of. What's the best way to communicate with congressional offices that don't know much details on the legislation being discussed during the meeting? Is there any instances that you can recall where you've met with constituent and that constituent was able to successfully articulate their points and it led the senator or representative to sign on to the bill?
I'll jump in. The one that I just mentioned, the Kids Online Safety Act, that was brought to us by a compelling mental health care provider who works primarily with eating disorders. And seeing her perspective and her work with that population made an impact on Senator Manchin, and he just decided to immediately co-sponsor. And we have, from whether it's mental health, Social Security, many different issues, veterans issues, energy issues, whatever it is, the most compelling advocates are those with, at least for Senator Manchin, and I would assume for many politicians, are those with real world firsthand experience.
Yes, definitely. And I'll jump in here too. I would say definitely the follow-up is very important. Like, what do you do after the meeting? Because of course, staffers have, let's say, like 10 meetings a day, right? What are you going to do to stand out and get you didn't come to DC for no reason. So what are you going to do to get what you came to DC for handled, right? We're all coming here, we all work here to make and create change. And then like my counterpart, Mara said, the real stories. I had somebody come into a meeting that was impacted by Hurricane Katrina. She lost her leg, and she was, talking about her story. She's also a veteran as well, and she was concerned about veteran housing. People that come up with real stories, compelling stories, just like that make you pay attention, right? Instead of just sending a lobbyist or something like that is just going to tell you what you want to hear, but real people, and then being very consistent. So consistency. So if you still haven't seen, the member that you spoke with sign on to a piece of legislation, follow up with them. And then also something that a lot of groups do not do is ask, can the member actually join? Not only with, the staffer that is, that has the issue area, but ask, can the member join as well? And then now the member knows, the staffer knows, you have more people within your audience that knows your issue.
And Sydney, if I can add to my colleagues on the panel, not from the congressional perspective, but when you're doing meetings with the executive branch, these departments, similarly to what Leila and Marish shared, great follow-up is, I'll ask very often for a policy paper, just to be able to highlight, like in written form, what are the policies, potential rule changes that you're passionate about and the rationale. And also I've found that even though typically the engagement on the executive level is during, the comment period for informal and formal rulemaking under regs.gov, there are other ways to interact, so both in the Obama and Biden administrations, obviously more recently virtual, but, hosting listening sessions where we will send an invitation and you can join and be able to further develop that relationship, which also happens during the comment period, of course, but it's keeping that relationship consistent. And the third thing I would add is, when you're presenting the policy postures you'd like the member to adopt, or, you'd like a department to take effect with a big omnibus bill, like the Farm Bill, for instance, at USDA. I encourage folks sometimes, especially folks who are passionate and understandably so, to be a little bit flexible, right? Because it's very difficult to say yes to everything. Usually it's looking at how can we find a place of compromise? How can we, create the right policy or make the right rule change to have the best benefit and impact the most amount of people? So, just be flexible and understand that nuances may change. You might not get exactly every single thing you're hoping for, but that's part of the process and, why we have to appreciate our democracy.
Absolutely. Lisa, I know that your background is a little bit different than Mara and Layla. What would you say are some common misconceptions that the public has about advocacy within agencies? And are there any specific guidelines or protocols that the public should follow when engaging in advocacy efforts with your agency?
Thank you, Sydney. I love what both Mara and Layla shared. I mean, it's so true. What makes me sad, and I've done my best in these positions, is to let people know that everyone's experience makes a difference, and one person's experience really does matter. So for instance, Mara talked about the specific case that persuaded Senator Manchin, particularly when I worked in the Obama administration. This was like in the height of the Great Recession, the aftermath of one of the most challenging times. So, having those firsthand client testimonials, or like, hey, the SNAP program in the state of Texas, we were supposed to be able to get our EBT card in 5 days, but it's been weeks. Like, that real-time testimony is really effective. And it can be as simple as an email. It can be, perhaps a community member shares it with an advocate who already has that relationship. And I think another tip I would share, particularly during these windows of rulemaking, like the Farm Bill, like it's Farm Bill season again, is there's a group of folks who are very familiar with and leverage these relationships in Washington, D.C., but it's not always as accessible. And if, you're in states, whether it's North Dakota or Texas, et cetera. So I've also encouraged advocates to think about, maybe you are, for instance, part of one farmers group somewhere in North Dakota, but there'll be like a national farmers coalition that's based in DC. If you don't have that relationship with them, develop those alliances, because one, it's just like a practical way to get your voice and position heard. And two, it makes you stronger, right? Because if you're saying the same thing as other groups in this coalition structure, then the echo is going to be that much bigger.
Thank you. Unfortunately, we're running a little bit short on time, so I'll wrap up with one final question for the panel. We talked about do's, but can we talk a little bit about things not to do at when meeting with your legislators that are helpful for advocates going into the meeting, and make sure that they do not do these tips? I'll toss it over to you, Layla.
Yes, the don'ts. So I would say just a personal story. I had a group that came in, very great group. I told them, like I tell any group, I will brief the congressman. I will, look over the ask that you all presented to us, because everything, that you all say is very, very, very important. It's important to the members, important to everybody inside of the office. But, we do need grace sometimes. We do need a little bit of time to actually look things over, because we do have back-to-back meetings on top of committee things, and then legislate, and then, a lot of the things. So, something that a group had did was basically say that I promised them, that I was going to get the congressman on something. I did not say that because they saw that a deadline was approaching and, my boss still had not signed on to something. And we're not supposed to make promises. We have to look into every single thing, like I said. But like I said, just give us grace and time. That's a way to not get your stuff signed on to, by saying that a staffer said something that they did not, or promised something that they did not promise.
Absolutely. Mara, do you have any don'ts?
Sure, definitely agree with everything Layla just said. One don't that I would mention would actually, there's two. First of all, don't forget about the state staff. I've had the benefit of being both in DC and in the state, and many times, not always, every office is different by all means, but many times those in the state are kind of the longest term staffers with a senator or a member. They're the ones that have been with them since the beginning, or, 1,000 different stories. So inviting the state staff to a group or to see your facility or an event that you're having, a birthday party, a groundbreaking, whatever it is, those really can make an impact because that state staff always reports back to the member and tells them what they're hearing. So they're an incredibly important part of advocacy. And then the second thing is don't forget about ethics. The counseling profession is thankfully guided by sterling ethics, and congressional and executive branch staffers also have ethics too. So, you may offer a staffer what you think they can accept. Just review that before you have a serious interaction, like before you go to DC for Hill Day. That's an important part of congressional ethics. And we have an ethics that guides us to what we can accept, what we can do, even down to our constituent services. So thank you for having me today.
Absolutely. And Lisa, do you want to provide any advice?
I think my colleagues provided great advice, and in closing, just want to thank you and Brian Banks for being able to join this great conversation today.
Yes, thank you all for joining us and for your leadership on Capitol Hill and then the federal government. And I know that our counselors at home we're taking notes and are going to use this advice when meeting with legislators. At this point, I'll turn it over to you, Brian. Thank you all again.
Hello, everyone. Thank you for joining us today. I learned a ton today, and I hope you did as well. My name is Brian Banks, and I'm the Chief of Government Affairs and Public Policy Officer for the American Counseling Association. Before you go, I'd like to remind you that this training has been recorded and will become available soon on the ACA YouTube channel at Counseling Views. The resources shared today through the QR codes on the PowerPoint can be found on the Government Affairs section of the ACA website, or simply reach out to the team by email at advocacy@counseling.org, and we'll make sure to get you what you need. Please remember to schedule your visits with your legislators soon. We are asking that you complete all of your meetings by the end of July and use the Virtual Hill meeting feedback form provided to you when you registered for this session. If you have any questions during this process, contact us. We are here to help you. For those that may not have time to attend the meeting with your legislators, you still can advocate. Please visit the ACA Take Action page on the Government Affairs portion of the ACA website. Every bill discussed today is there, and with a few clicks, you can send a message to your members of Congress. Also, keep an open eye for the first edition of the Government Affairs newsletter coming later this month, where we will actually recap this session and give you more information that can help you in your advocacy efforts at home. Thank you again to our presenters. Those are my friends, and they did an awesome job, and I'm glad they were able to join us today. Thank you, ACA members and stakeholders that joined us as well. And I want to give a special thanks to Gila Todd, Sydney Sinclair, and Dominique Marcelik, your ACA Government Affairs team that has made history and will continue to do so on behalf of the counseling profession. It is our job to educate, empower, and protect this profession, and we will continue to do that day in and day out. Thank you again for joining us, and we'll see you next year when we return to an in-person Hill Day. Goodbye, everyone. Thanks again.